Although the Health Ministry justifies its exorbitant expenditure on fuel and workshops, the Ministry of Finance officials want them to get their priorities right. The Ministry of Finance's Assistant Commissioner for Social Services says Ministry of Health has wasted about 3.5 billion on meetings as well as fuel and lubricants for their fancy cars. These are some of vehicles belonging to the Ministry of Health that are under controversy. For a while now, these Land Cruisers have been alleged for swallowing most of the monies allocated to the Ministry of Health that would otherwise go towards improving health services in the country. These cars have a consumption capacity of between 3.5 to 4.8 litres of fuel and are also expensive to service. But despite these disadvantages, most health officials love to cruise in them against all the odds.
They have spent more on fuel, workshops and the rest, as opposed to what would be like in hospitals.
So we are working out a mechanism of censoring the workshops that are going to be undertaken, and they have to be coordinated even up to district level, so that when districts have a schedule from Ministry of Health and anybody thinks he has money, he wants to start a workshop and is calling people, it is taken as distraction from the actual work they are supposed to do, and it is stopped. Despite a clear spreadsheet detailing the wastage of the taxpayers' money, the health officials insist they could do with more funding. The Ministry of Health is a mobilizing ministry. When you are talking of prevention, when you are talking of promotion and rehabilitation, honestly, you cannot run away from mobilization. And if you are traversing the countryside, the roads as they look, you don't need simple vehicles. So when they talk of Land Cruisers again, you find they are not becoming realistic. In a meeting held at Africana, stakeholders nonetheless agreed to support the increase of funds in health, citing it as a crucial life and death sector. Fred Matyama, UBC TV in Kampala.